We believe the Cern device is the first and only patented microbicidal light device for treatment of fungal and bacterial vaginosis. The device may offer those for whom drug-based therapies are neither effective, appropriate, or desired a safe, convenient alternative, without the negative aspects associated with many antifungal or antibiotic drug treatments. There are over 79 million women in the U.S. between the ages of 19 and 49. According to the Center for Disease Control, over 9 million women in the U.S. are under a physician's care for treatment of fungal or bacterial vaginosis. Bacterial vaginosis is present in as many as 22 million women, with 16% or 3.5 million classified as symptomatic under a doctor's care. The majority are undiagnosed, as symptoms may not be present or noticeable. Recurrent fungal vaginitis, defined as 4 or more occurrences per year, is present in as many as 12 million, with perhaps 50% not responsive to treatment. This total number is underreported, as many women do not wait until their 4th occurrence to seek medical treatment by a physician. FDA discussions suggest the Cern device be made available initially as a prescription. The device is intended for use at home as needed, when needed, based on familiar recurrent symptoms, so as to avoid the inconvenience of repeated office visits. An attending physician may be provided the ability to remote consult as well as monitor device usage and outcome. Shaped and sized similar to a tampon, the Cern device, inserted for 30 to 60 minutes, may be effective in controlling both bacterial and/or fungal infection based on dosage. In a healthy microbiome, naturally occurring yeast and bacteria reside together in a symbiotic relationship. When a yeast or bacterial indication occurs, it is most often caused by one achieving dominance over another, moving from symbiosis to dysbiosis. The Cern device uses low-level microbicidal light in the visible spectrum, which can be pathogenic to both yeast and bacteria based on dosage. Specific wavelengths of light, through a process known as reactive oxygen species, disrupt the pathogen cell's DNA, inhibiting their ability to reproduce, enabling the microbiome to return to a state of symbiosis. Data from initial studies indicate the Cern device may be optimized to treat microbial pathogens without harming beneficial species found in a healthy microbiome. Systemic antifungal antibiotic drugs may deliver as little as 2% of the medication to the targeted area. The remainder must be metabolized through the patient's organs and can be toxic. Clinicians and patients are concerned with overuse of drugs, whose efficacy is diminished as pathogens develop resistance and whose use may contribute to negative drug interactions, and which may not be appropriate for women who are pregnant or immunocompromised. The Cern device may be effective against both yeast and bacterial indications, enabling women for whom drug-based standards of care are neither effective, appropriate, or desired to live healthier, empowered lives.